Hello and welcome to the Senior Resident tutorial on how to give good feedback on EPA assessments. Let's start with a case. So you're a senior resident in the Emerge and it's the first day of the rotation. The junior resident on your team asks you to do an EPA for them. So what is it that you need to do exactly? And some of you might even be wondering what even is an EPA? And once you figure all that out, how do you fill one out? Well, during this tutorial, I'm hoping to address some of these questions. I'm hoping to give you a brief introduction into Competence by Design, and then talk to you a little bit about your role as a coach for junior learners. So by the end of this talk, I'm specifically hoping that you'll be able to describe the basics of Competence by Design, understand what an EPA evaluation is and how it's used and how you can complete one. And finally, I'm hoping that you'll be able to follow an evidence-based strategy for providing feedback to learners in a busy clinical setting. So let's start by talking about Competence by Design. So CBD is going to be a huge shift in how we think about medical education in Canada. Now, for residents currently in the program, I want to start by assuring you that you do not need to worry. We're not going to change your curriculum on you. You're not going to be switched into a CBD curriculum. But in 2019, all new internal medicine residents across Canada will need to be into a CBD program. So even though your curriculum won't change, you're almost certainly going to be helping to train residents in a CBD framework. Now, I'm really excited because I think that CBD is going to make training a lot better for residents. I think it's going to lead to better doctors, but it's definitely going to take some getting used to. So I want to start with a quick primer on how CBD works. So first things first, what's wrong with how we're currently doing things? So in a traditional residency education, it's very time focused. The focus is all on completing your rotations. You do your time and then bang, you're ready for fellowship. Now, as you go along, there are ITERs and there are other evaluations, but they mainly serve to stop people who are doing very poorly. Our assessment of whether residents are ready for progression right now is basically, did they fail a rotation? And this is a very blunt tool. So this is a problem that's been recognized by the Royal College, and they've laid out what they think the problems are with time-based education. So first of all, they say time-based education, for better or worse, has fostered a culture of a failure to fail in residency programs. Also, because most assessments are at the end of a rotation, the focus really is on judging residents rather than coaching them along. Also, learners consistently report that learning objectives are unclear the way we're currently doing things. And it's also easy for learners to slip through the cracks because, as I mentioned, our assessment tools are quite blunt. So the whole idea of competency-based education is that there's this list of things that you need to be able to do to be a good doctor. And the focus of training should be making sure you can do all the things in that list. So we shouldn't treat training time as an end unto itself, but instead really focus on making sure that we use training time as a means to get those competencies, to get the things on the list. And the idea here is that training should take about the same amount of time, but now the time isn't enough. You need to use your time to demonstrate competencies. And in this model, you progress through your training by demonstrating competencies. And the progression looks a little bit different. So the current model looks something like this. Really, there's only 2 stages, and on July 1st, PGY2, you magically become a senior resident. In CBD, things are broken up a little bit more into these things called stages, and the progression is based on demonstrating competencies. So the first stage is called the transition to discipline, and this is analogous to the first couple months of PGY1 when you're a brand new resident. After you've demonstrated the necessary competencies, you then progress on to the foundation stage, which is analogous to the current PGY1 year. After that, you would then go on to the core stage, which is sort of like what we might call a senior resident right now, sort of like the PGY 2 and 3 years right now. And then after that, you would go on to this thing called transition to practice. Now, in a terminal Royal College program, this would be the time after your exam where you can hone your skills before going off to independent practice. In internal medicine, this would be sort of like the PGY 4 year, although things would be a little bit differently if you were going into a subspecialty program. So, who decides if residents progress? Well, to decide whether or not you go to the next stage, there's this thing called the Competency Committee. This committee takes each resident, looks at their evaluations, decides how they're doing, what their trajectory is, and when the time comes, promotes them to the next stage. And the main tool that the committee uses to make their assessment is this thing called an EPA, which we're going to talk a little bit more about in the next section.